Um, yeah, so thank you very much for joining us. What will happen just before we start is that Megan has recorded this session. It's a question and answer session on the 10th of March. So any information that is given during this session relates to guidance that is up to the 10th of March. So just so that everybody is aware, things obviously will change and can change. So if people go back and look at this recording, they're aware the guidance is what we give from the 10th of March. So hopefully that makes that clear. Well, welcome everybody that's joined us. We've probably got too many people to go through to say hello to this morning, but welcome everybody. What we'll do, as usual, we have an agenda and we'll go through each item at a time. We'll talk about the information relating to that particular item on the agenda, and then we'll take any questions that you might have in relation to those questions. Now, I think, am I right, Megan, that I think we may just have Rowan here from our CCG colleagues.
Yes, at the moment that is correct.
Okay. All right. Well, if there are any questions relating to our CCG colleagues, public health, etc., that we need clarification with, we will refer back to them following this meeting. So we'll take the questions, we'll refer back to them, get the answers, and then send them out to you. Okay. So, Megan, did you want to put the agenda up? So for the purposes of the recording, my name is Christine Footer. I'm the Chief Operating Officer of Norfolk and Suffolk Care Support, and Megan is our Communication Administration Executive here today. Okay, so I'll just wait for Megan
Yeah,
to
I'm just getting the agenda up now.
That's okay, Megan. Thank you very much.
Right.
Thank you. And welcome everyone that's just joined us. Welcome in. I think you've just popped in as well. So that's lovely. We're going to work through the agenda. And as I say, if people want to ask questions as we go through, I'll stop after each agenda item and ask for any questions that you may have. So the first item is booster vaccinations and flu vaccinations. So I just wanted to make everybody aware that obviously vaccinations and availability of vaccinations is still available, that there are links that you can go to set up your vaccinations. There are sites still across Norfolk. There is a roving model as well, but the roving model only goes to certain places on certain days. And so that information is going to go into our e-bulletin with the proviso that sometimes they may have to be cancelled. But we will give the information of where they are and what's available. So also to alert you to the fact that the jab cab, as it's known, is available for you to contact. So if any of your staff want to get to a pharmacy or anywhere, as long as they've booked their vaccination, they can get the jab cab. They can phone them up and they can take them to their destination, pick them up and return them to their destination. And that service is available now until the 31st of March. So again, information of that will be in our e-bulletin as well. And we've just popped the details of the jab cab as well into the chat box. So unlike the general population, that jab cab is also available to take people for flu vaccinations that's specific to health and social care. So just for you to be aware that you won't see that in any public information, but it is available for social care staff. Are there any questions around access to booster vaccinations and first and second vaccinations, etc. Does anybody have any queries on that? And
You
has
can pop
anybody
your hands up.
used? Oh yes, Mark, come in, Mark.
Yeah, just a question. Great that we got all these centres, but are there any provisions made for people who can't leave the home, or is that being operated through the district nurse system, please?
So the vaccination rollout did go out. So there were district nurses to people's own homes. So there was a list of people that were at their own homes. They were contacted to see whether or not someone could bring them into GPs or PCN sites. But where that was not possible, district nurses were then allocated to go out to the community, Mark. So it did take a little longer because it's very resource intense, and obviously a lot of resources went into the mass vac sites and to maximise the uptake of the vaccine. But it was undertaken. There was quite a bit of work done in each PCN area, and they had lists and numbers, and they reported back on the number of people that they vaccinated each time we met. So it worked. It worked very well. Boosters as well. Yes, boosters as well. Yeah. I don't know, Rowan, whether you have any sort of information on that from your perspective. It certainly was what came back to the vaccination planning meeting, but I didn't know whether you had any other comments or observations on that.
I don't think so at this stage, actually, Christine. Haven't been directly involved with the vaccination programme, but if there are any questions, I can take them back to colleagues in the CCG if there's anything else. Yeah.
No, that's absolutely fine. Thank you. I have got I did have a hand up, but I
Yes,
also
Anita, I think it was you with your hand up.
Sunita, did you want
It's
to
me.
come
I
in? And then I
wanted
have
to.
a question. Sorry, Sunita.
Sorry, I'm from the coach house in Hemsby. I just wanted to know, is the fourth vaccination being rolled out for the service users now?
So the fourth booster vaccination is now being discussed. The guidance for it, and I think Megan will put that in the chat box as well, is out.
I just wanted to book some transport, please.
Oh, can we just put yourself on mute? That's great. Thank you very much. That's fantastic. So basically, this is for people that are 75 plus, who are residents in care homes for older people. Just older people, for older people, residents in care homes for older people, individuals aged 12 and over who are immunosuppressed or identified as immunosuppressed, and people aged over 75. So on Wednesday, we had our vaccination planning meeting. I asked the question at the meeting, when are we planning for the rollout in the care homes for this fourth booster, or this spring booster? And I was told it would be, well, they're planning this week, and it's looking like it will be from the 21st of March onwards. So as soon as we've got more information, Sunita, about that and how that's going to operate, we'll be back in touch with you.
It's just, can
okay?
I say, we are getting the letters already for the residents. Can you book your appointment for the fourth vaccine? And I thought for the residential care homes, they should be booking to come to the home rather than we trying to book an appointment. So there's some communication information being passed on nationally, but they should not be, letters shouldn't be sent. I don't understand the purpose.
So these letters, Sunita, have come from the Department of Health and Social Care, is that right, to
Yes,
individual
yes,
residents?
yes.
I'll raise that. I will raise that with the National Care Forum to take back to the Department of Health and Social Care. And thank you for letting us know.
Thank
And you
you.
are absolutely right, Sunita. Local delivery is being discussed and arranged. And as soon as we've got the details, we will let
That's
you
the
know.
one, yeah.
Thank you. Is that all right?
Thank you.
That's okay. But that is terribly confusing and not particularly helpful, is it? So we will report that back for you. So thank you for sharing that with us.
Thank you.
Yes, so yes, the guidance came out this week that that would be happening, and the local delivery partners, the PCNs, GPs, etc., and pharmacists will be discussing how best that could be delivered locally.
Thank you.
Okay. Were there any other questions in that respect? Because I did notice, I think, was it you, Howard, that had your hand up earlier, or has your question been answered?
But that was a mistake. So
Oh, that's okay,
yeah,
Howard.
carry on.
That's absolutely fine, Howard. That's absolutely fine. I just didn't want to overlook anyone or any other questions that people might have had. Okay, so we're now on to, if that's okay with everybody, unless anybody has got any other questions around the booster or the vaccinations, flu vaccinations, I shall move on to the second item. Okay, well,
Nothing in the chat either, Christine, at the moment.
no. Okay, so the second item is the revoking of the vaccination, a condition of deployment. So what we have got now is the result of the consultation from the government, and they are revoking vaccination as a condition of deployment. They had the consultation and they have published the outcome of the consultation. I think, Megan, have you got that? If not, I can pop that in the chat.
Yep. I'm just grabbing that now and I'll pop it in the chat.
Lovely. So the intention is to lay the necessary legislation to revoke this regulation for both care homes and the wider social care and health settings. You may have seen information go out that says revoking NHS, but it's actually wider than that. It's revoking not just the social care settings that were included in that second round, but also care homes. So they will, we'll just move on here. Yes, so that will end on the 15th of March. At midnight, basically. There is a question and answer session on the whole issue. The response from the government also stated that the government intends to launch what they're calling another separate consultation on the code of practice on the prevention and control of infections to strengthen requirements in relation to COVID-19. But we're waiting further detail. So we have had questions about what next, what happens when you don't have people double vaccinated, or it's a requirement, what next? So we're expecting a consultation on those codes of practice. There are discussions going on around testing and guidance for that as well, which we'll pick up in the next agenda item. But that's all the information we have on revoking the vaccination as a condition of deployment. Does anybody have any queries in relation to that, or is that all quite clear now? So one of the questions I did have in a previous meeting earlier this week was people asking, does this apply to care homes? And yes, the answer is yes, it does. And that puts care homes in quite a challenging position. Well, challenging in that staff that have lost their jobs may return if if A, the home wishes them to, and B, the individual wishes to return to the home. And I don't know whether any care homes have had any issues with that currently, where people have come back at all. Have any of the care homes on the call had that? I mean, Sunita, have you had anybody that you had to terminate their
I
contracts?
didn't have to terminate anybody. So there was a plan to terminate for this lady about April time, because she will not have the vaccine because of the anxiety. And she's
Yeah.
like only doing 2 shifts a week, and she does the evening. She gave her a letter to say that she needs to be vaccinated, but then the guidance has changed. So, and she's a very good worker. So we didn't have to go down that route for terminating. One of the other staff didn't want to have the vaccine, but she's actually had 2 dosages already now. So that was positive for us. So she will
Very
go
good.
for the booster. So we haven't got anybody who's not had the vaccine. The only problem we suffer at the moment is the agency staff is ensuring that they get their boosters done, because we have regular agency staff at night and during the daytime, but they've all had 2 vaccines, but we'll still encourage them to have the boosters. So we're just waiting that they will do that as well.
Oh, that's good. Yeah.
Flu jab is the difficult bit. A lot of staff will not have the flu jabs.
That's an interesting one. And
Mm.
Rowan, I think that's something that we've picked up quite a bit in various meetings around flu vaccinations, is that I think with the focus on the
COVID.
vaccinations, COVID vaccinations, yes, Anita, the you know, the first, the second, the booster, that people have not taken up the flu vaccination as a result. The uptake of flu vaccination has never been fantastically high. And Rowan, I can see, is nodding her head. It has not been high anyway, but it seems to be particularly challenging this year.
We should give them incentive of money to £10, £20 for with the flu vaccine. They might come and have it done.
That has been done before. I don't know about whether it's been
Or
done
a
in
voucher
care
or
homes.
something, you know, because something
it-
needs to be done.
It has been done in some organisations, different incentive schemes.
Mm.
Yeah, we will be looking at that, Christine, and how we can encourage staff to get flu vaccines.
Because
as well.
certainly this time, Christina, I want to bring it up. We've had a lot of people with coughs and they were COVID negative. And we actually had the public health people come and do some respiratory swabs for us, because they had said, and they all had rhinovirus. So that's all part of the flu virus they had. And they'd had flu vaccines as well, these residents. So it's something the staff obviously will be picking up from the residents, the similar sort of viruses as well. So it's very difficult. Certainly flu virus needs to be encouraged for the staff, you know, something needs to be done. Or when you guys come and do the vaccines for the residents, just do all the staff at the same time. It should not be, oh, you go to your surgery, you go to pharmacy, you go there. You lose the, you know, basic continuity with the staff that way.
Thank you, Sunita. And there are a number of research projects that are taking place currently, including one with the UEA and Amrish Patel, that's trying to get data around that very issue about the efficacy of the delivery model and the impact that has on the take-up of the flu vaccinations. So I think it's really important that people contribute to that, because that gives us the evidence, doesn't it, Rowan, to really campaign for a particular type of delivery that encourages the maximum take-up of this vaccination.
Absolutely. Yeah, no, it'd be interesting to hear more about that, actually, Christine. I didn't realise they were doing that, but that's a really interesting study. But part of it as well, it's not just about, you know, by having the vaccine, you're protecting the residents, but you're also protecting your own families as well. So it's, you know, it is a really big thing. And we are going to be relaunching our infection control champion network, Christine. So we will be really promoting the the flu vaccine through that and be getting people to present about it so people can really understand how important it is, not least in the landscape of COVID that we're in. It's, you know, it's more important than ever. And because restrictions have been lifted now, you know, in the community, it's very likely we will have a less good flu season this year than we have over the last couple of years when people have had such tight PPE restrictions. So, yeah, it's really important.
Thank you so much, Rowan, and that's really interesting that the Champions program will be picking that up. I think that's a really good idea to provide people with the information so that they can cascade it back into their organisations and, as you say, become champions within their organisations and be equipped with that information and support in order to do that.
Yeah, obviously it's about identifying someone that's really interested in infection control within your organisations, and for those people to be able to lead on infection control within the care home setting.
That's brilliant. Thank you, Rowan. I've got 2 hands up now, and I've got something in the chat box, so I'll just take the hands first. So Ian was first, and then Mark. So Ian.
Yeah, I just wanted to make a quick comment to kind of reinforce in terms of the uptake with the flu jab, my experience has been it's been much harder and much slower than the COVID. I think for a number of reasons. One, because there's probably people who either they've had flu jabs in the past and either had reactions, or they've had years in the past when they haven't had a flu jab and nothing's gone wrong. It's just harder to get people to do it. And also, I think the amount of effort we put into making sure people got the COVID vaccines, then to start a new conversation or to try and increase the conversation to flu jabs, I think a lot of people were like vaccinated out. So whether that's contributing factors or not.
That's useful, Ian, as well. And I'm sure those are the sorts of issues that are going to be picked up through the Champions work as well, to address them, to answer them, to provide information, to counter arguments and discussions and so on. So thank you. That's really helpful, Ian. And Mark?
Yeah, just a quick one. Maybe Rowan, you can help on this one. Obviously, we've lost the legal back course now to say, certainly with the COVID vaccine as a VCOD. What do you think the position would be? And I know you can't give strict legal advice, but what do you think the position will be if we actually said to our seniors that a condition of being made as a senior is that you accept the flu vaccine as well? Because I think that's so important that we do actually uptake that as a regular thing. Within the NHS, is there any sort of scheme like that, and is it binding? And what I don't want to get caught out is any form of discrimination. And of course, if people can't have it, I accept it, but I just would appreciate some feedback and some guidance on this, please.
But in my experience, Mark, the first time there has been anything like this in terms of a condition of employment has been with COVID. I think that there has never been anything before that in relation to the flu vaccine. And sadly, well, from my perspective at the moment, I think you probably would be on pretty dodgy ground with that. But, happy to talk about it some more. But yeah, that there isn't anything to my knowledge around any kind of legal framework in association with that, unfortunately. And I don't know if there ever will be, but certainly happy to discuss with colleagues and feedback anything. Yeah.
But thank you, Mark, for asking, because it is something that providers are concerned about, is about what they can legitimately put in conditions for their contracts. Mark, it is a legal issue and it's a HR issue, and we have been asking this around solicitors that are employed on behalf of the social care sector, and they've always been very cautious of adding this to contracts. But what I can do, Mark, is also raise it again as a query, and see what they come back with, going forward. But it is a legal issue.
I think it was actually really surprising when we were told that it was going to be a condition of employment vaccination for COVID. I think everyone was very surprised, and it's a human rights issue, isn't it? So it's really difficult. Yeah.
It is, but it didn't stop them bringing it in, did they?
No, it was very surprising. Yeah.
Yeah.
But there are so many people. There is a high percentage of people who have very, very strong feelings about vaccination. And I think that's, COVID has brought that to the forefront, hasn't it? And I think people have been surprised at how many people are out there that do not want to have a vaccine. And I think that there's a whole raft of people that have changed their minds during COVID, but then there's a whole other raft of people that continue to be absolutely anti-vax. And it's a very interesting subject.
Yeah. Ian, you've got your hand up again. So do come in.
Yeah, so I guess it's just to make the observation that the fact the government had to bring in 2 sets of legislation to make it legal requirements for care homes, and then everyone else probably answers your question about whether or not you can bring it into kind of terms and conditions. I think obviously right at the start of COVID, there was profile companies who made a stand and said we were going to do this, but I guess they also had a lot of resources to kind of fight any legal battles. I mean, anyone else, and I'm not a lawyer by any stretch of imagination, but I think if the government had to bring in legislation to make it a legal requirement, it'd be very hard for anyone else, or you'd have to put so many caveats in to cover,
yes.
That it then becomes meaningless anyway. But yeah, that's what I think.
Yeah, thank you. Ian, I think we've exhausted the questions, and I think, Mark, your point in the chat box, I think we just sort of picked up as we've just been discussing as well. But it is a really challenging issue now that we are where we are. But I guess one of the things that we have to bear in mind is that the discussion is still going on with the government about the next steps. And this leads us nicely into our next agenda item, which is the testing in care homes, supported living and home care. So basically, to summarise, you probably have noticed that all of this guidance came out at the same time it was on the 25th of February, and I think Megan will pop them in the chat box for both.
Yeah,
for all of them,
I'm on it.
You're on it.
Popping them in now.
And home care. Basically, to summarise, there was very little change in these, but they've been updated. Nothing of substance changed, but the DHSC and the UKHSA expectation is that guidance around testing, isolation and PPE remains in force for the time being. So basically what they've said, and all of these guidance documents virtually say the same thing. The update is there's no longer a legal requirement for people with COVID-19 to self-isolate. However, the public health advice for people with any of the main symptoms of COVID-19 or a positive test result is to stay at home and avoid contact with other people. Due to the higher risk nature of health and social care settings, the advice for staff members working in these settings has not changed. So that was the update. So basically it's saying that whilst this is happening in the community, etc., for us working in social care in those environments, we follow the existing guidance. what is believed will happen is that there's going to be sort of a substantial update, but also consolidation of all the social care guidance towards the end of this month, or it might be the middle of this month, given that they're revoking on the 15th of March. But we will know more then. However, probably the issue which is concerning a lot of care homes at the moment has been the issue of outbreaks and the number of people that have got COVID recently. It seems to have increased, and this obviously has huge social isolation implications and impacts on providers. And what we've been told is that they are expecting to have some changes to the outbreak guidance because of this near continuous outbreak and lockdowns that's happening. But we haven't, no guidance, no updated guidance has been produced as yet. The only difference will be around the isolation periods. You know, it was 10 days, but under certain caveats, you can reduce that isolation period with negative tests from day 5 and 6, as long as it's consecutive negative tests, that you can reduce that isolation period. Apart from that, everything remains the same, and we're just waiting to see if we've got any further information, if we're going to get anything out around outbreaks, because we have had questions from providers around this very issue. What can we do? Because this is, you know, this is so difficult to manage, and it's preventing, you know, people coming out of hospital potentially. There's also isolation for staff, etc. So it makes it very difficult to manage the service. But that's the latest update on all of those guidance documents. Please remember, you follow the guidance until something's changed. If you have any concern or you're not clear about anything in those guidance documents, I would suggest you contact either your quality monitoring officer or to contact public health around specific issues, particularly around outbreak. And I think the details for public health have been put in letters to you, which have the public health details. They're available Monday to Friday 9 to 5, and then there's another contact, which is a regional contact for anything outside of those hours. So does I hope that explains everything as it stands. But does that anybody have any questions? And Rowan, was there anything you think I needed to add to that?
No, I think you've summarised that really well, Christine. You're exactly right. Obviously the guidance for the public came out, but nothing has changed otherwise in terms of health and social care to date. And just going on to a regional infection control call yesterday, I think there will be some stuff coming out in the next 2 or 3 weeks, but it's all very vague at the moment, and we've just got to wait and see. We have been told that we will be receiving some new guidance, and as soon as we do, obviously we can share it with colleagues. But yeah, I don't think that there is anything to add. Obviously, the live documents that you've put in the chat are the very latest, and they are live documents that are continually updated. So those absolutely are what people should be working to.
Thank you very much, Rowan. That's helpful to have it reinforced as well. Thank you. And Sunita, you have your hand up.
Sorry, I like to raise my hand up quite often.
That's all right, Sunita. That's what we're here to do.
I just wanted to ask, because since we had the COVID outbreak, obviously we're not testing our residents who were positive before for another 3 months. But the guidance I had read was that we're doing daily tests for the staff as a lateral flow test, and we'll only do the PCRs if the lateral flow is positive. because the courier service has reduced quite a lot at the moment, and they will not collect any specimens if you're having any specimens less than 8. And we had difficulty with the residents collection in the last 2 weekends because we were doing the repeat testing because they had been negative. So that's the difficulty we had. So I just wanted to know that should we be doing the PCRs for the people who were negative, the staff wise, but I understood it was lateral flow tests now and only to do PCR if lateral flow is positive.
I'm just going back to the guidance.
So from guidance, what I have is from 26th of February.
That's right. That's what the guidance is from the 26th of it. There's been no change to that at all.
So it's the lateral flow, not do we be doing PCRs as well for the staff?
It's whatever is in that guidance is what you have to do. And it says residents and staff displaying symptoms of COVID. Yeah. It's that. And it says staff with symptoms of COVID should stay at home and conduct their PCR test in their own home or go to an in-person test site. Following a PCR test, residents can also be tested with LFT for speed of detection. The LFT can provide an early warning that someone is positive and inform the outbreak management approach whilst awaiting the PCR test.
Yeah.
If either the LFT or PCR is positive, the resident should be treated as having COVID. So that is what is in the guidance at the moment, Sunita, and that hasn't changed.
Thank you.
Is that okay?
Yes, lovely. Thank you.
Thank you, Sunita. Oh, I have a new message. I'm trying to keep an eye on hands and messages and information. Here we go. So, Mark, the important thing is to maintain access to testing for all staff and clients. We've had mass tests nearly 100 people in the last week, LFT and PCR. Obviously, it's just following the guidance as it is. What we don't know, Mark, is what's going to come next. That's the issue. And that's what we're waiting for, isn't it, Rowan? Is the next step.
Yeah, we're waiting for national testing policy, really, to be updated and for people to know exactly if there will be any changes or not. So watch this space is all I can say. It may well not change at the moment.
Yeah. It's just so important that's why I mentioned the date and the guidance at the moment, because we are expecting possible changes, and given the 15th of March is the revoking of the VCOD, there could be changes announced from there. And I know they're discussing things like testing, use of masks, all of that is all under discussion currently, and obviously isolation. So we just don't know what the next steps are at the moment, and like Rowan says, we're just waiting to see the next set of guidance. And we really just don't know.
I think it is really difficult at the moment for people, Christine, because obviously the rules have relaxed for the general public, and maintaining tight vigilance on PPE use in the environment, in the care home setting where we know we continue to have outbreaks is so important. And it's very difficult because it's really confusing for people. So we do appreciate that, but really important to maintain that vigilance as much as possible, really. So it's a difficult time.
Yeah, definitely. And it's the same with home care and supported living as well. It's about vulnerability, it's about risk, it's and I know Mark is from a home care provision, and obviously it's as of concern in the community as it is in a care home as well.
We've got Lorraine in the chat as well, Christine. She's got, "Are LFD tests free? We tried to order some for the day centre and we were told we had to pay for them."
That is through Norfolk County Council. I think that's something we need to go back and check with Norfolk County Council. Let me just get, because there should be availability of some, but it's under certain conditions. So let me just double check that. Guidance. Get this up for you. Okay, published. Maybe it's day services. We can always go back and check that for you, though. Here we go. I've got it. I've got it.
And Annalise
put
has
this
come in as
chat.
well and said that she's registered for a UON with NCC, which is the code, and now get them for free.
Yeah, there we go. I knew there was something to do with registering, but I couldn't remember what the conditions were, etc. The information is there in the guidance, Lorraine, and if you have any issues, we do have a UON number. So Lorraine, do you want to come in? Are you okay about that? Do you think you'll be able to get them now?
Hello everyone. Vicky tried to get them for the day centre because some of the people that attend the day centre also live in the residential homes, so they test before they come to the day centre.
Yes.
And also some of the staff that work in the day centre work in the respite unit. So we were running short, and when she put an order in, we were told that we had to pay for them.
Right, okay, so I think that's something you need to pick up with Norfolk County Council.
Okay, thank you.
Yeah, because it says which adult daycare centres are eligible for testing. It says testing is recommended for all open daycare centres that are run by paid care staff. So presumably that applies to you.
Yes.
Services must be for adults over 18 and are provided within non-residential care settings that support the health and well-being of adults. They're purpose-built day centres attached to a part of a home or other buildings in the community. Why is testing important? How are you involved? Adults, service users, care is unique. So NHS Test and Trace assigns all participating organisation a UON. Daycare centre managers will need to use this. Ordering kits using this. Contacting the National COVID Contact Centre for support. So when you say the council haven't supplied it, it doesn't come from the council, it comes from the DHS, the Test and Trace. So I think you need to contact 119. That's the number in here in the guidance that's given. Let me just pop that in the chat. I hope this will come out, and if not, I'm sure we can get it to you afterwards. Oh, it's not very clear, but you'll see it in there, hopefully. There you go.
Thank you, Christine.
Is that okay?
Yes,
and
thank you.
If you continue to have any other issues, do come back to us and we'll see what we can do to escalate it. Is that all right?
Right, that's lovely. Thank you.
Okay, Lorraine. Okay. Is there anything else anybody's got around testing at all? Any other queries around that? I know, I think, have we got Trina? I think Trina, is Trina here?
Yes, I am.
Oh, hi, Trina. I think Raj asked about the question about outbreaks and the concerns about outbreaks and isolation periods. So I think we've covered that off. We are expecting an update in that guidance. It doesn't help, but to remind Raj about that, you can reduce the isolation periods given certain circumstances, as clarified in that guidance.
Yeah, we're following public health information at the moment because we've got a recent outbreak that's undergoing testing, so they're guiding us through it. So the quicker we can get out of outbreak mode, the better.
Raj is in the meeting now as well, Christine.
Oh, Raj. Oh, welcome, Raj, as well. So we've covered that off for you, and I think Rowan, that's what we're waiting for, isn't it? It's around this outbreak management as well. We're just waiting.
Exactly. Yeah.
Sorry, can I just ask I know we've got all this sort of guidance. This is 14 days and everything else, but we've also got.
It's not 14, Raj. It's 10.
10. We've got a lot of campaigning going on from residents groups, and even in PMQs yesterday, an MP asked about the isolation and everything else, and we're being caught between a rock and a hard place from families and guidance. And if you look at some of the sort of publicity around it and the misinformation that the MPs are getting, we're being sort of penalised here because, you know, we have to follow guidance. We're being told that actually it's up to us what we do. Family support groups are really, you know, pushing this in the press and through various MPs and having meetings in Parliament, and we're not getting much of a say in this.
Rowan, did you want to come back on that?
Are you talking particularly around, sorry, Raj, around staff isolation, or what are you talking about particularly?
Well, I guess it's staff isolation, and also the fact that if you've got an outbreak, you can't have visitors, and it's residents groups that are actually up in arms over it. If you see some of the headlines, they're demonising providers for doing what they want, and you know, cutting off their relatives and loved ones, and I guess my concern is that actually that's not what we're doing. Yeah, we're having to follow guidance, because if we don't, we're you know, between a rock and a hard place. And it does concern me a little bit that some of these sort of militant groups are getting some credence. I mean, they held an event in Parliament yesterday, and they had like 50 MPs attend, and one of them went and asked the question at PMQs yesterday. I don't know whether anybody saw it. And it really sort of demonised providers for locking their doors. But can we help it if we're going literally from outbreak to outbreak to outbreak? I mean, it seems to be an ongoing thing.
It's kind of what I was sort of alluding to earlier, really, which is this sort of mass confusion that has occurred as a result of relaxing restrictions in the community, but not in health and social care settings. So that there's a whole sort of feeling of having relaxed COVID, if you like, and almost for some people the pandemic's gone away, when of course we know it hasn't, because outbreaks are very much still happening in care homes. What I do know that our public health consultants would say always, absolutely always, Dr. Boyka Raquel, that often comes on this meeting, is that we should follow guidance, and then we can't be penalised, as you were saying. Very, very difficult. It's really not helpful. You know, we have a particular stance coming from our Prime Minister at the moment, and it's really difficult. I'm not really sure what to advise. I
mean,
I think the only thing you can do, Raj, because I think we could end up going a little bit circular here, is that that we take this back to our national groups and say that we're concerned that care providers are, as you say, being demonised for following guidance that limits the number of people that can access their residence. It's very clear in the guidance that essential caregivers can still do so, but that you would not allow people in during an outbreak, and you will be receiving information through that outbreak team. So I think it's really important that we go back to the DHSC and to other groups to make them aware of the pressures that particularly care homes are under in this area, to try and get more support for them. But we are expecting some more guidance around outbreaks in care homes over the next few weeks, Raj. So I think it all feeds into that as well.
I mean, you just put in the chat about essential caregivers. Well, we pushed that and promoted it and wrote to all our residents, families and things. And I think we had one person that took it up. So I don't know how you go about promoting it further.
I mean, I don't know who else is on the call, Raj, that has got essential caregivers. I think last time, if I'm right, and I might not be, but Sandra, I think you mentioned you've got some essential caregivers. Is that right, Sandra? Are you on the call still?
Yes, no, I'm still here. Sorry, I'm doing a little bit of work on the side, but I'm still here.
Right.
We do have essential caregivers, yeah, but as the testing regime is altered now, and staff only do the lateral flow, it's the same as, like I said before, it's the same as any other visitor then, isn't it? The guidance says that an essential carer does the same testing program as a member of staff. And members of staff are only supposed to test prior to their shift. So that's testing right. Prior to a visit is what we expect everybody to do, even though we have continued to let our essential carers that were our essential carers to continue to come in the building with the thought that if there is an outbreak, they will be expected to do the same PCR testing program as the staff.
Exactly.
But that just, you know, I don't know what else more to say, because I am considering that it seems such a long time, and I'm sitting here thinking that, you know, maybe we've been lucky that maybe we could open our home up more in a more controlled way, because it does say that in the guidance. If you can risk assess and do things in a controlled way, as far as infection control in your building, then you can allow visitors in. Now, I'm sitting here listening this morning and I'm thinking, you're all saying how many outbreaks there's been, and I'm reconsidering that thought, which is really hard. And I'm thinking, if the guidance then goes back to being quite stringent, that the impact on us is probably going to be immense. Anyway, I don't know if I answered your question or not.
No, it's fine. The question was, do you have essential caregivers, and do people come forward as essential caregivers? And I think people do. The next point was, in outbreaks, who can enter the home, and the guidance is essential caregivers can still enter. You're absolutely right. They are part of the testing regime and considered part of staffing as a result. Therefore, they follow the same testing regime. The issue is, once you have an outbreak, is that constant where you can't come in now, because if you're not an essential caregiver, you can't come in. And then, as Raj says, it is being portrayed as the care homes being like closing their doors, not allowing people in, and actually giving a bad press to the care home, where in fact they are following guidance. So the sooner that we can have an update on the guidance and a bit more, I don't mean relaxation in that, you know, you take away risks, but a little bit more flexibility, like you say, Sandra, then people could risk assess more appropriately in their own environments and make decisions that support their environments.
Sunita's popped in the chat as well, asking if anyone is fully open to families and visitors, because they'd be interested to hear, especially with Mothering Sunday coming up.
Oh, right. Well, I presume that's for anyone that's not in outbreak, I guess. Has anybody? Sorry.
Yeah. So we're in a situation, we have had this awful drip of one person. We get near to the 14 days, then we have another person, and so on. We're finally unlocked as of this week, and so we anticipate having visitors in for everything, including Mother's Day.
Oh, right, Karen, that's great. Sunita, how does that sound?
Sounds great, as long as you can accommodate all the visitors on a Sunday with the 35 resident in one unit and
right. Well, we do We do have a booking system.
So you still do the booked appointments? That was another
We still
question.
do the booking system. Yeah, we don't.
On the weekend as
we
well?
don't have a tidal wave. 7
No.
days a week.
Yeah, so you have booking on the weekend as well?
Yeah.
7 days a week.
Yeah, that's
Sunita.
fine. So I just wanted to know, because expectation from the family members maybe like they used to be able to come without any appointment, walk in, show the lateral flow test, and off they go, you know. And the staff shortage, which it has been, has made it quite difficult to open the visiting fully. I think that's been a big problem for a lot of the homes, you know.
Everybody's very used to the booking system. We've been using it when we're in a position to.
Yeah.
For over 2 years now. So
we've done that, but we are thinking
very
of
familiar
opening
with
on
it.
Saturdays and Sundays. And this is why I just wanted to find out. So it's not a problem. Quite happy to know that everybody's doing the booking system, you know.
Yeah.
And we still have essential people coming in for the people when they're at the end of life care without any appointments. So it's all mishmash, they call it, you know, and then they get to hear, so one is allowed and we are not allowed, and why are we not allowed? But
yes,
it's getting better, I must say.
Well, that's good to hear, Sunita. And there's Pat's also put in the chat box, we're open to visitors fully, but still having the booking system. Pat, did you want to come in? Are you there, Pat?
Hi.
Hi, Pat.
Yeah, we are fully open as well, like that. We still do the booking system, and we don't allow more than one family to come in at a time as well. We're just trying to manage it, because January, February, we had to lock down because it kept going on. Like one lady mentioned, they say like when it's all clear, then we get one positive. So we kept rolling on like that. So we're being careful. So we only allow like 2 persons coming at any given time, and they need to book in. They need to book in. Yeah.
Well, I mean, I can just hear you, Pat, but thank you very much. That sounds as if it's getting a little bit better and positive for you as well. And as long as you can manage it, that seems to be working well. So it's good to hear. Good to hear. So thank you, Pat. Thank you. Okay, were there any other questions from anybody around admissions and care of residents and care homes guidance? Just to reassure Raj, we'll just continue, Raj, to make those points about perceptions of care homes, particularly during outbreaks, but also about managing risks, etc., up to the DHSC, because it is a challenge. It really is for yourself as a care home provider. Okay, the next guidance is management of staff exposed patients or residents in health and social care settings. Now, if I just, are you able to pop that in?
I've popped that in the chat already, actually, Christine. I did it with our earlier discussions.
Okay, lovely.
You're ahead of the game.
You are ahead of the game. Okay, so in relation to this, very little has changed. Again, the update is there's no longer a legal requirement for people with COVID infections to isolate. However, public health advice for people with any of these symptoms of COVID or a positive test is to stay at home to avoid contact with other people. And due to the high risk nature of health and social care settings, the advice for staff members working in these settings has not changed. So basically, if you've seen that and wondered what the change was in that guidance, it's simply to update that legal change now, that it's no longer a requirement to self-isolate. Were there any issues or questions around that management of staff and exposed patients and residents in health and social care settings? When will the requirement to upload test results end? Bob, we just don't know at the moment. We're waiting for guidance. We haven't received anything as yet. it will come out in guidance, but as yet we haven't got it. Bob, did you want to come in? Be great to speak to you as well.
Oh, Bob, you are muted. I don't know if you can come off mute.
If you can't, don't worry. Oh, hi Bob. Hi Bob.
No, it's just that uploading the test results every day for staff, that's quite time consuming, and as they're mostly negative, and there's no test and trace active anymore with the government. I don't understand really what the requirement is for that, because all we get is an email back saying the number of tests that have been registered every day.
Yeah, it's a really good point, Bob. That's a really good point. We can definitely raise that. Raj, did you want to come in and answer?
Yeah.
Oh, sorry, Lorraine's got her hand up as well, Christine.
Oh, I beg your pardon.
I think she was first. Sorry to butt in.
So sorry, Raj. I'll come back to you. I promise I'll come back to you. Lorraine.
Hello, sorry. Christine, can I just ask if the LFD test is still positive after 10 days, can staff return to work?
They will need to seek clinical advice on that. That's the information. I think it's actually in the guidance as well. It says to seek clinical advice on that. That's right, isn't it, Rowan?
Yes,
Rowan's
it
nodding
is.
her head.
Yeah, it is. Yeah. To do a risk assessment. Yeah.
So I mean, I think it's about going to your GP, getting that discussed clinically. Because some people do, and we are aware that people continue to test positive 10 days after, and yet are absolutely fine. So it's just about having that clinical oversight of it.
Yeah, exactly.
Right, thank you. We have just had a breakout in that, well, the last 2 weeks, and we've just now come out the other side. So it's taken a long while.
Oh, Lorraine, yes, it's terribly. It's exhausting, isn't it? It's exhausting for everyone. Yeah, I hope everyone's okay.
They are. Thank you.
Okay, Lorraine. And Raj.
Just a quick thing on the last Lorraine's question. NFTs aren't always that accurate, so if you do a PCR as well, just to double check it, I think that might help to sort of determine whether somebody is positive or negative, especially after sort of 5 or 6 days. Sometimes you get different results, so I think there's a saying, isn't there? If you do the same thing, you're going to get the same result. So try something different. Yeah,
I think you'll find, Raj, that if they have already done a PCR test, because it depends, I suppose, Raj, what you're saying. If they've only done LFT tests, then they probably do need to do a PCR. But have they done a PCR at the beginning and then LFTs? You can't really, you shouldn't be doing any more, because after 60 days they pick up viruses. It's very difficult to know what's accurate. That's right, isn't it, Rowan? That's why there's that 90-day gap between testing.
Yeah, you can still pick up dead virus within 90 days with. Sorry, is that what you were saying?
Yes.
Yeah, that's right. Yeah.
So that's why after 10 days, Raj, you're advised to go to your GP or get a clinical decision, advice, etc.
Just to pick up in the chat, Tarina's said there was a change in the last update. Now LFTs before every shift, even if they have previously tested positive. Previous guidance was not testing with either PCR or LFT.
So that's changed, Trina. Where is that in the guidance?
It changed in the last one. They put it in previously that if you tested positive, you tested with nothing for 90 days, so you didn't test at all. And then when they updated the last version, they changed it back that you test every shift with an LFT before you come on shift. The PCR is still 90 days. You don't test for 90 days with the PCR.
Right.
Yeah, it is in the guidance in the LFD for the previously positive cases.
Yeah, I think that is correct, Tarina. Certainly the PCRs will
still pick it up, so that's why we
up,
don't test with those at all.
But not LFTs.
Yeah, so every time they come on shift, before they arrive, they've got to have a negative result before they step over the threshold.
Yeah.
But that goes back to Lorraine's point, really, doesn't it? So that they've picked it up on an LFT, not a PCR. They've been positive and then they're positive again. I think that's just go back to your GP, isn't it? That's what it is. It's just, you've just got to go back and have that conversation, because you may have something else and it may need to be examined, or as Sunita has said, it could be long COVID, something like that. So it's go back to your GP for testing. Oh, sorry for advice. Hayley, did you want to come in?
Oh, sorry, I think it was
Raj
Ian first.
Raj.
We've got Raj, then Ian,
sorry,
then
Raj.
Hayley.
Oh, sorry, Raj.
I was just going to ask about the previously with staff isolating, they were getting full pay. Those additional bits of funding have all pretty much run out. We are continuing along this sort of path of the pandemic and people constantly getting it and having to isolate for 10 days or whatever. How are we expected to fund this now going forward?
Raj, that is a question that is a different arena, a different forum, and something we just is being discussed with the DHSC for exactly that reason. We have no idea at the moment, absolutely none, and it is about what happens next, what they're going to decide around testing, around vaccinations, PPE. We just don't know, and until we know that, Raj, I don't know. We don't know if PPE funding is going to continue, testing funding is going to continue. We have no indication at the moment, Raj. But the DHSC are fully aware of the implications and costs. Fully aware.
As long as we're putting that forward to them, because obviously a lot of providers, if you've got like 5 or 6 staff isolating continually, that's quite a costly exercise for any provider to one little outbreak, and that's fine, but when it's ongoing and continuous, it's a huge challenge.
And a huge challenge, a huge cost. It's loss of business. It's so many things, Raj. So yes, absolutely, that is all information that is being passed up to the DHSC and part of their general overview of all the data and information that they're getting. At the very beginning of this meeting, that's what we discussed, which was we are expecting some changes, but we just don't know what they're going to be at the moment. Rowan, that's right, isn't it?
Yes, that is correct. Yeah.
And this will cover everything. It will cover things, as we've discussed, PPE, testing and all of that, because it does have cost implications for care providers, as well as risk implications for your staff, for your residents, for people that you visit. So it's enormous. Right, is that Hayley?
Ian did have their hand up.
Oh, Ian.
Yeah.
Oh, Hayley's has gone down and Ian's up. Okay, Ian.
Yeah, so I do also have something to add to A.O.B. if we've got any time left for that. But just my understanding around with PCR testing, if somebody had a positive test, but they stopped doing their asymptomatic testing, which has fallen by the wayside anyway with LFTs coming in anyway. But my understanding was that if they developed new symptoms, they were supposed to do a PCR. So I don't know.
I think that is right. I think that's what we've established, but it's also about getting clinical advice.
Sure.
Yeah.
To read the bit that I think is pertinent.
That would be really helpful,
Christine. So
yeah, thank you.
So routine testing with LFD tests within 90 days of a prior positive test If a staff member has returned to work after testing positive for COVID-19, they should resume routine LFD testing, even if this is within 90 days of the positive COVID-19 test result. Right. If staff, patients or residents are tested with an LFD test within 90 days of a prior positive LFD or PCR and the result is positive, they should start a new period of self-isolation unless a clinical or risk assessment suggests that a reinfection is unlikely. This risk assessment should inform subsequent action, including whether isolation is required. So it's a bit ambiguous, that.
It is,
and it is, as Christine was saying, that you would get a clinical risk assessment, but Tarina's absolutely right that you would continue LFD testing, but not PCR testing, which would pick up the dead virus. Whether any of that is going to change or not, I don't know, but that is what should be happening at the moment. I hope that that clarifies a little bit.
Yeah, thank you. I think the message is just get clinical advice, really, because we just don't know if it's a reinfection or something else. So and if it is, then obviously we do go back into the cycle of self-isolation, but really need to get that checked out.
Yeah.
Thank you very much. I think that's it in terms of the guidance that we've had. I do understand there are comments in here which relate to other issues which we're not discussing today, so we won't be picking those up, but clearly they will be taken out into other arenas, and they are absolutely valid, and it is a very unknown time at the moment about what the next steps are. So what we suggest we do is, as soon as there is new guidance issued, that we probably have a follow-up meeting, because it could be our last meeting then, but a follow-up meeting so that we can look at the impact of the guidance on your particular services and raise any questions from that. I think we got a date that we suggested, Megan, at the moment in April?
No, we haven't set one yet, but it would probably be the first 2 weeks of April. I tend to put them a month apart.
Definitely, and it probably needs to be at the beginning of April, because I suspect the guidance will come out in the next few weeks, so it'd probably be better to look at the beginning of April. So we'll have a look at that together.
Sooner as well, if we need to. So
absolutely. Mark, did you want to come in?
Yeah, if I may, please. I'm become one of these geeks now, because you catch me out when I don't see things that I should have seen. I read a lot of the stuff that comes through, and it's just a reminder to many of the people here that the Norfolk County Council actually have a surplus of PPE still, and that's entirely pertinent to what we're talking about today. They actually have a surplus free provision of PPE, and if anybody hasn't seen that and they get in touch with the NCC, that they'll supply it free of charge, and it's something well worth having if we're discussing infection control here.
Thank you, Mark. And I think the supply of PPE is dependent on the need, and so it will be assessed by them as need. Yeah. And how long they'll have that for, Mark, as well, is another debate as well. So I think a lot will just depend on what the next steps are in the guidance around testing and PPE. Are there any other questions? And thank you, by the way, Mark, you've put in the chat box here, which came back on something that Raj had raised before. So as this is being recorded, I will read it out. If you have time, hang on. How much easier it is to maintain public support when we're acting in accordance with strict guidance as opposed to advice about good practice. This is where the demonisation factor comes in. We are still paying full wages from the funds and grants supplied to all staff who are positive or symptomatic, and will as long as we can afford to. So thank you, Mark, for that comment as well.
Ian's got their hand up as well, Christine.
Oh, Ian, come in.
Yeah, so have we now moved to any other business?
We have indeed.
Okay. Yeah, it's just something I've really come across the last few days when I've been doing some assessments, because I'm in home care, is just of really becoming aware of the mental health pandemic that is now kind of out there, with people who've spent the last 2 years being really isolated. Their social networks have really atrophied, and the types of packages that NCC are trying to commission really aren't covering that. And it's and it's about trying to get some focus on that and some resources. But I know it's a lot harder than physical stuff because you can't put up as many statistics. But I mean, a couple of chaps I've been talking to this week, they've had 2 years of being afraid to go out because of COVID, and now they're starting to be afraid to go out because of the cost of living increases. They're talking about not putting their heating on, not kind of cooking proper meals. So again, if we could maybe start to look to pull some resources together so that there's signposting around kind of financial support with kind of cost of living increases that are coming, kind of good signposting to kind of mental health, and also to put some pressure on NCC when they are commissioning to actually factor in those sorts of factors, because like I say, maybe got people who haven't had adequate care for the last couple of years. So like I say, one of the people I went to social services, to be fair to him, did agree to actually give us a session the day before we start to go in and clean the house to make it actually safe and acceptable for staff to go in. I mean, I have a fairly strong stomach, and I will think back to my student days and the states of places I used to live in. But yeah, I mean, yeah, some of the places I honestly wouldn't want to keep pets in, let alone people. So just I know obviously kind of there's loads of pressures all over the place, but there's people whose mental and physical health is really deteriorated over the last couple of years, and now we need to find some ways of making sure that gets picked up, and we're not just keeping people alive in squalid conditions, and actually supporting people to kind of, whether it's rehabilitate, recover, regain the confidence to go out and about, not be kind of terrified of the financial situation, all that sort of stuff.
Thank you very much, Ian. And it picks up on a number of points that have been raised in the meeting, which is, about impact on business if things happen, like testing gets changed, or people don't have access to funding. So there's the whole issue around cost of care, and then there's the impact of COVID on people that you are supporting. All of those will have to be picked up in other forums and arenas where that will be debated, but we will pass that information on to ensure that Norfolk County Council are aware, commissioning are aware, and so on, as is the same with all the cost of care exercise, which is dealt with in the cost of care arena. But they're all absolutely relevant points, and all have come out of COVID guidance and the impact that's all had on all of you. So I'm going to have to end the meeting here now, but thank you very much for attending, everyone, and thank you for all your questions, and thank you for your contributions.